Hey guys, welcome back to our channel.
Hi.
It is currently Thursday. As I promised, I told you guys that we are coming back to the doctor today for a follow-up. We are going to see what he has to say today and where we go, if the wound's looking good, if he's satisfied with it, when he wants me to come back. Are we going to need to cut it back open? So we just got here. We're in the parking garage. We're going to start making our way to the actual office. So when we get in there, hang with us, and we'll continue to record and we'll go from here. Thanks guys, hold on. Hey guys, so I'm in the elevator here by myself because we just came through the check-in where the nurses take your temperature and get some information. And for some odd reason, today they're not wanting him to come with me. I don't know. I've got to ask the doctor here in the office what's going on and if he's allowed up, if they'll call and have him come up. So I'll let you all know. Hey guys, so I'm sitting here in the waiting room. I'm trying to whisper so that I don't make any disturbance because there's about 3 of us in here. I'm going to turn the camera to let you see that. He is here with me, so we're just waiting for them to call us back in the room, and I guess we'll get back there and we'll go from there.
No fevers at home?
Yeah, no fevers.
Okay.
Which I didn't notice the smell. Usually, I mean, my nose is really strong and...
No, it's really good. So, I mean, there is going to be an odor to any wound like this, okay? Any open wound, there's going to be bacterial colonization of it,
right.
And it leads to an odor, especially when it's wrapped up under a dressing and it's moist all the time. So that's pretty typical. Doesn't necessarily mean there's an infection.
Now the bandage that was on it and how it was bandaged, is that okay?
Yeah, absolutely. Yeah, see, we're still getting this little cavity here where there's some fluid accumulating.
Yeah, that's been like that every time we pop it open.
Okay, so you've been popping it like that?
Yeah.
Okay.
And then we've actually been squishing it to where I'll squish it, then we break for a second, I'll squish it some more, and then I'll squish it until we hear like air escape. And then once we hear the air, then we start wrapping it back up. You want me to push on it?
I'm not getting as much as I did last time, but it's still accumulating in that deep pocket.
Yep, that.
Okay, so you've been doing that every day?
Yep.
Okay, good.
Yeah, the first time it made that sound, it scared the crap out of both of us. It was like, oh, that's not normal.
Well, so again, there's a cavity that's underneath there. You know, the opening at the skin level is pretty small, and then that leads down, and there's a larger cavity.
Up to here, right?
Probably, yeah. And that's kind of what we saw in the OR. I mean, that area of fluid collection was pretty big. I was hoping this would work. I didn't want to fully open the whole incision and leave you with this ginormous wound.
Right.
But unfortunately, if we had done that, it's easier to get it to kind of fill in. At this point now we're dealing with, it's healing super well at the skin. I mean, this is rapidly closing and filling in, but that deeper cavity has not had a chance to fill in yet. So,
What option does that leave?
well, I would like to stick with this for a while. I mean, the biggest danger is leaving that fluid trapped in there. Okay, so as long as you all are comfortable, it doesn't seem that tender for you to be jabbing the Q-tip in there. That's not.
No,
I imagine the nerve endings are pretty dull by now, and it probably isn't that sore. So if you're able to do that, as long as you do that every day and you get that fluid evacuated, over time it should be less and less fluid and give that area a chance to kind of stick down. Okay.
Is it good to push on it until we hear
Yeah.
that noise?
Yeah, I mean, just push on until you're not getting any fluid evacuating.
Okay.
Because again, we don't want any of that fluid just being trapped in there. We
Now,
want,
should we do it more than once a day now?
yeah, maybe twice a day. Again, as long as it's comfortable for you, I think. Yeah, why don't we just move and do it twice a day? It feels good. I mean, it's nice and soft. I don't, as far as antibiotics go, are you allergic to anything?
Mhm.
Okay. I mean, we can try a short course of oral antibiotics because you're right. There's a little bit of an odor to it. Again, it's probably more of just colonization, but the fact that it is deep inside there, I mean, I think it's reasonable to treat it with an antibiotic for a short course at least. I don't see a lot of downside to that.
Okay.
The skin doesn't look infected. You're not having fevers. So I think it's okay, but I don't see a lot of downside to treating it.
Okay. Now, do you have any recommendations? Because with my diabetes being full effect and getting my insulin regulated, I've lost about 10 pounds since we did the full surgery.
Okay.
But I've noticed my stomach is going into like an egg-shaped form instead of what it was before, which is just kind of rounded out. I know that has to do somewhat with us cutting the stomach muscles and all of that.
Mm-hmm.
Is there anything that you can recommend that can help, I guess, pull that back in maybe, or not go into like the cone shape? Or could that be just because I still have that pocket in there that's...
Yeah, some of it could be that pocket. And I mean, the short answer is no. I don't know that there's much we're going to be able to do. With that pocket there, the scar tissue is still remodeling. So I'm not sure what it's going to look like long term yet. But yeah, let's just try to open that pocket up and drain it twice a day, if you're comfortable with that. Otherwise, the wound looks really good. It's healing very nicely. I'm concerned that we're leaving some fluid trapped underneath there.
So now I guess my next question would be is, how long would you want to try this method before you say, okay, it's not working and we should probably go back in? And
I mean, I'd, as long as you're feeling well, I'd put it off for a while. I mean, certainly several more weeks. Okay.
Okay.
Yeah. I would not be in any hurry to open anything back up.
Okay.
Because if we did that, again, we'd probably have to do like a much broader incision, and I don't want to do that.
Okay.
I don't think it's necessary yet.
All right.
Not at all. Okay.
Well, that works for me.
All right. I know it's a nuisance, but
Oh, no,
you're taking good care of it.
Okay, guys, so it looks like he's going to have a prescription wrote out for an antibiotic for me. He said that he will be out of the office next week, so he wants to see me the following week on a Thursday. As of right now, we're just going to kind of ride this out and continue on this path of recovery, and I guess if anything else changes, we will go from there and continue to record it. And I hope you guys hang tight with us. So if you like this video, give us a thumbs up. Make sure you subscribe and follow along with us. All right, guys. Thanks for